Hospitals across our state are coming up with contingency plans to figure out what to do if they lose some staffing because of vaccine mandates. Traveling healthcare workers could help fill the gap, but they are in high demand, i.e. expensive. Anusha Roy digs into this complicated situation.
When COVID struck, the folks at Lincoln Health in Hugo found themselves relying more on traveling healthcare workers in their long-term care facilities.
They decided they resigned their positions, either because it was really hard during COVID. I think it was hard mentally on our staff. It was hard mentally, and physically. The work is hard.
Then rates for traveling certified nursing aides doubled in less than a year, from $32 to $39 an hour in January to $80 an hour now.
How long can you guys last, paying at this higher rate to bring people in?
I think the reality is we can't.
So as they work on getting creative with staffing, like how to best utilize nurses,
I'm worried about the loss of nurses to our workforce. I really, every day. It's one of those things that wakes me up at night.
Concern over staffing is very real. Part of it is vaccine mandates, according to the Colorado Hospital Association.
We have heard from some of our hospitals that some of their staff will leave because of the vaccine mandate. It could be happening even later this week. And some hospitals may choose to terminate employees.
But also because this last year was really hard and healthcare workers are burning out. Traveling staff have to follow the same vaccine requirements or have an exemption in Colorado. Costs are going up because there's a shortage of people, a lot of demand, and an ask for hazard pay because of COVID risks. But if traveling staff is part of the solution, the question is it even affordable at this point?
Well beyond what they would normally pay and may even be able to afford even in these extreme times.
And who is it hurting the most?
I'm worried across the board, but if you really ask me where it's critical, it is in rural.
Yeah, that's because you're dealing with really different budgets and staffing levels. When you're looking at some of our smaller hospitals, there's not a lot of wiggle room for them. There are also a lot of people now looking to the state for some help who actually reactivated their staffing fusion center. So that's basically the state stepping in to fill staffing shortages. They said it's not directly tied to the vaccine requirements, but to help with the stopgap staffing, and then said federal funding is helping out to pay for that as well, Kyle.
And the state of Anusha is about to start collecting some detailed information to figure out what they're up against here.
Yeah, because a lot of people want to know, what are the vaccine rates in our hospitals? And today was kind of asking one hospital at a time. But starting tomorrow, these hospitals are going to be reporting not only vaccine rates, not only exemption rates, but twice a month, they're also going to be reporting what their staffing levels are looking at, just to keep track of how many people are still working, how many people ultimately did leave their jobs.
Next viewers are going to be missing you here in the coming weeks, because at the end of this week, Anusha, you are about to start your maternity leave. I've said here before that one of the things I admire most about you and your work is that you're always seeking out the challenging and the complex issues, because you know that those are the most important. Well, wait till you get a taste of parenthood. You're going to love it.
Yeah, no, I'm just on standby right now for my entire life to be completely changed. So, yeah, this will be the biggest challenge, but I can't wait. And yeah, I'll be gone for a couple of months, just kind of settling into motherhood best that I can.
I hope you love every minute of it. You won't, but I hope that you do.
I can't wait.
It'll be great. All right. Thank you, Anusha.